All right, we'll do a call to order at 16:37. We'll do our pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you.
That'll take us to item number 2, roll call.
Zach,
Yes.
Joe,
Yes.
Tom,
Yes.
Lynette,
Yes.
Audra, here.
Thank you, Audra. It's like, oh no, I said yes. That'll move us on to item number 3, adopt agenda.
I'll make a motion that we adopt the agenda as written. Second.
Beautiful, thank you.
Zach,
Yes.
Joe,
Yes.
Tom,
Yes.
Lynette,
Yes.
Audra, yes.
And that'll take us to item number 4, meeting minutes for September 24th, 2025. I did not see any issues when I skimmed over it, but I only skimmed over it.
I didn't have anything.
I make a motion to approve the minutes as presented.
I'll second it.
Beautiful.
Zach,
Yes.
Joe,
Yes.
Tom,
Yes.
Lynette,
Yes.
Audra, yes.
Cooking with gas.
That's right.
And that'll move us on to item number 5, 2026 budget hearing.
So barring any further amendments to the 2026 budget that you adopted in September at the 24th, on the 24th, the budget, what you have is what was adopted at that time. The resolutions that I gave you are completed with using those figures. So unless there's any changes to the budget or resolution.
Nothing with all the mess in Washington, that's gonna mess with the budget next
No,
year?
I think we'll be all right.
Think so.
Yeah.
Yeah, I feel pretty comfortable with,
I feel comfortable with 26, 27 scares me.
yeah, I think so, but I think this puts us in a good place to prepare for it at the very least. So it's a crossing the bridge when we get there sort of thing, as long as we're set up appropriately. I'll entertain a motion to adopt the 2026 budget.
The resolution.
Budget resolution.
Yeah, it's, if you look at the heading,
Yep.
yeah. Next page. There you go.
To adopt the 2026 budget, appropriate sums of money, and authorize the certification of the tax levy for the Trinidad Ambulance District.
I'll second.
I'll make
Can I
that-
make,
Oh,
I'll make that
motion?
motion.
okay. And I'll
and
second.
Lynette, you second?
Yes.
Okay. Zach,
Yes.
Joe,
Yes.
Tom,
Yes.
Lynette,
Yes.
Audra? Yes.
There you go, Joe.
Need your help to pop me up.
That'll move us on to the director's report.
Do you have your little clicker?
I do.
Yes.
Deferred property tax for previous month is $117,896. That has not changed, and I'm guessing that's because we submitted our audit late. So we'll see a change on the next financial statement. Our general fund bank account had $1,768,646. Our enterprise bank account had $2,168,779. For a total cash on hand of $3,937,425.50. And that's up $206,335.08 from the previous month, so we're looking good there. Our year-to-date net income for the district is $537,440.72. For the enterprise, it's $215,960.67, for a total of $753,401.39. And that's down roughly $160,000 from the previous month. We did receive our Medicaid supplemental payment for the total amount of $202,073.82. So that's good, and I'm getting ready to submit that again. It's due on Thanksgiving. Just my pretty colors. Our year-to-date billing performance through September, we billed out 1,324 EMS trips. Gross charges are over $4 million. Our contractual allowances are $1.8 million. Our payments collected are $772,361.82 for a net collection rate of 36.2% for the year, which isn't terrible. We want to be between 35 and 45%, so we're doing okay. Our September collections, we had 145 trips, gross charges of $459,439. Our average charge per trip was $3,168.54. Our collections for September are $32,555.91 for a cash per trip of $224.52, extremely low, and our net collection rate is 8.3%. Dr. Becker's working on scheduling the training for next month. What are we doing, quarterly trainings with him?
Yeah.
No change for the property at 939 Robinson. We've had trouble receiving payment from them. We tried to set up ACH and they said that wouldn't go through, so they told me they mailed it last week and we still haven't received it. So we reached out again today to see where they sent that to and see what's going on with that.
But they're moved in?
Yeah. Yep, they're over there. I got the statement of work and the purchase order for the grant. I need you to sign that so I can submit that. Otherwise, no change and nothing for the whole blood for rural Colorado. We provided, do we do 3 transports now out of Spanish Peaks? It's 3 transports out of Spanish Peaks for secure transport without incident. I renewed our KISS license for another year, so we're good until October of next year. Our attorney fell sick last week, and so he asked for another extension to this Friday, October 24th. So that was granted, and he will have a draft. He just emailed just about 15 minutes ago and said he'll have a draft by this evening. So we'll have a draft to review for the opening arguments. And then I still haven't heard back from San Rita Crystal Hospice on the agreement that they wanted to sign. I confirmed that the email went through on August 19th, and I left a voicemail this morning, so I'm just waiting for them to get back to me. So we've got 2 bills that we're pushing at the state legislature right now. One is EMS and essential service, and I am on that subcommittee. We've got a draft, and we've submitted it to the bill drafter. So we're just waiting on feedback, and we'll just work back and forth. And then we've got another bill for treatment in place and for mobile integrated health. And Deputy Chief DeTrey is on that subcommittee. And I don't know, are you guys on?
So we have two sponsors. We have not got a bill drafted yet. The main one, I think, is the essential service, and it was going to be the opposite way. But the person that's actually running the committee is actually working with the legislators and some doctors ahead of time. We have a meeting tomorrow at 10 o'clock with the 2 legislators that are willing to carry that bill forward. So that'll be to help us get paid for the treatment in place and also help with the mobile integrated health and getting paid for that as well. So it's really good.
Yeah, that's awesome.
So with the government shutdown, our Medicare add-ons extenders expired on September 30th. So what CMS and our billing company advised was to hold any Medicare payments or Medicare bills until October 14th because we run about 14 days behind to process bills. So we were on hold up until yesterday. CMS decided that we needed to start billing those Medicare payments again. So we're going to start processing the Medicare payments, but they're going to be without the add-ons because those expired on September 30th. So we'll be losing 22.6% on those Medicare payments. They have reported that some of the payments that are being paid out are still having the extenders on them, which if that's the case, then if they pass a bill, nothing happens, as long as the bill's retroactive to October 1st. If a bill's not passed, then those agencies will have to pay that extra amount of money back. So I don't know, we haven't received one yet, they just released it, so we'll see what the bills come out. But we've been holding those.
So in short, we'll need to hold on to any of the extenders
Yeah.
until we see that a bill has been
Right.
passed, that they won't require us to return the money.
Right.
Gotcha.
Essentially, and I'm not real concerned because this happened, I think the last time this happened was 2005 and it went for like 30 days. And they always do the extenders, so I'm not real concerned
So
with
it's
this.
not a new situation?
No, it's just kind of keep your ears up and watch out for it.
Write your legislators.
We talked about the Rural Health Transformational Funds last month. We met a couple times and we submitted what we want to apply for to the state. The state's got to apply on our behalf to the federal government for this. The only issue is we tried to partner with the hospital association and they basically said, yeah, we don't want to partner with you. We're going to go ask for all the money ourselves, which is against what they want to do. A part of this fund is they have to show partnership with local EMS partners. So that's gonna, I hope that doesn't hurt us, but we'll see what happens when HICPUF, the Medicaid provider, is the one that's got to apply for this at the state level. So our safety cloud reports, I'm not going to read through all these.
Can you go back one?
Yes.
So you contacted our local hospital desk?
No.
Okay.
So the
You lost
state
me.
met with the hospital association
Okay,
to try and
Got it.
partner the EMS advocacy and the hospital association.
got it, okay.
And the
their
hospital
lobbyists
association
got
said-
with their people and
Yeah.
they said, we're going after all the money.
Okay.
Alerted 1,118 drivers last month. 7 are sent and received. And I'm not going to go through all that. There's Zach's pretty little pictures.
I do like that these have been dedicated to me.
Yeah.
That's very
I'm
nice.
going to start putting that on the thing.
Yeah, I appreciate that.
I'm not going to go through all of my meetings, but October 2nd, we had the stakeholder meeting for the rural health funds to present something to the state, because we had to have it by, what was that date? By October 10th or 15th, I think we had to have that submitted. So they had time to prepare for it. So I submitted our new accountant stuff to our attorney for review, and she came back and said, that's really high. Can I suggest somebody else to you? So we said, yeah. We met with that person on October 3rd. I wasn't comfortable with what they were doing. They have one ambulance district and they're volunteer, and 2 fire districts that they do some EMS transport. So I felt JFS was still the way to go.
Yeah.
So we're still working on an agreement that the attorney's okay with before we sign that.
Cool.
So we met with them a couple times last month. So the state, we had the SEMTAC meeting, and the state wanted to stand up the interfacility task force again. So we're gonna stand up that interfacility task force at the state level again, so that we can push for some more safety subcommittee and see if we can get something going with it, the interfacility stuff. October 16th, we had the state come down for ground ambulance license inspection. And it really wasn't an inspection at all. They just came and looked at some policies and said, you basically kind of get a freebie this year. We're trying to help you guys out and make sure everybody's on the same page. So moving forward, it'll be a little bit more stringent, but this year they basically said, let us know how we can help. We want everybody to get through this process. So that went off without a hitch. And then October 17th, we had a meeting with First Due. Our schedule is just not working very well, our scheduling system. So we're gonna meet with them and get a quote and see if we can do something different. There was 5 ambulance crashes. I'm not gonna read through all these. There was 3 in October. 1 assault on providers in October 5th, and this was a law enforcement thing. They were firebombing vehicles in Boston, and so Boston went ahead and they made a resolution to hold everybody accountable for those and ensure first responder safety. There wasn't really any ambulance service closures, but they did note a lot of wide strain financial burdens due to the Medicare extenders expiring and the government shutdown. That's what a lot of these headlines are based off of. Same thing, these top 4 are the same thing, ripple effect of the government shutdown. October 13th, HMP Global Learning Network put out a financial toolkit that emphasized COVID-19 funding fragility, low reimbursement, and the need for better fiscal tools for EMS agencies. So they know that financing is a problem and collections is a problem. They just don't know how to fix it or won't fix it.
But at least it's starting to be focused on, because previously it was just
Yeah.
us that knew that.
Right.
Everybody else thought
Yeah.
we made tons of money.
Yeah, it's a little more widespread.
Mhm.
There's an ambulance in Pennsylvania, and this is a poorly written headline, but basically they're gonna have $500,000 deficit in addition to what they were already looking at. South Dakota, they're seeking to pass legislation for reimbursement for treatment in place, which we're working on, so that's kind of cool. And then New York City, the governor vetoed legislation that requires 2 qualified EMS responders on every 911 call because it's going to cost about $25 million.
So we're sending 1?
Yeah, I guess. I don't know.
Wow.
I didn't read that story, so I don't know the gist of it, but that's what it sounds like to me.
In New York, we're sending 1?
Yeah.
Everybody's leaving New York anyway, so.
Yeah, there's that.
Yeah,
Why is that
sure. Yeah.
And then staffing shortages, so there's a special report on October 20th. 59% of responding agencies report not having enough personnel to respond to 911 calls. That same report reported 76% cited burnout as a critical issue, which I am getting kind of concerned with here. We're fully staffed, but we've got 2 people on workers' comp,
Mhm.
and we've got like 15 or 20 part-timers, but nobody wants to work or can't work.
Mhm.
So I'm worried that our staff's starting to get burned out, and I don't know how to fix it without dropping a car overnight or doing something. So I've been looking at different ideas to try and fix it, but I don't have a solution. In New York State, between 2019 and 2022, active EMS responders declined by 17.5%. And EMS services dropped from 1,078 to 982 in that same time period. Company in Oregon cited retention issues for response times and staffing. that's basically it.
Did you see the one that just came out today about MedStar in Fort Worth?
I did not.
So MedStar was one of the biggest MIH providers in really thinking outside the box, responding community paramedics and taking 2 hours to do it, and people were just astounded by actually getting help. And they tier their system, so they send the BLS calls, they just send EMTs versus paramedics, all this stuff. There was a shakeup, Fort Worth takeover. Now the fire chief, the union is basically run the fire chief out of town because the union is mad now that firefighters have to do EMS stuff. And so they refuse to do EMS stuff now that they've taken over MedStar. So now they've lost the fire chief, and this whole thing is just probably going to turn upside down and blow up. Just horrible.
Well, this is why EMS is an essential service and why you can't have other people, you can't have private industries, can't let fire departments do it. It's like it
Well,
needs to be its own.
I mean, there
individual
is
thing.
that division. There's firefighters that just want to do fire stuff.
Mhm.
I mean, there's.
Well,
That's why
we-
they're firefighters.
Yeah, we ran into that a lot where it was, I mean, they still gave pretty good care, but they were fire departments that had rescue trucks, and you could tell, you could make inferences based on how much infighting there was to not have to do a bus shift. And it was nonstop. It was, I want to be on the engine, I don't want to do a bus, and they would put in rules, so it was you had to be on the ambulance at least once a month, and then you could ride on the engine. And it's like, dude, it's just not the way it should work. It's not we need people that want to be here. It was like, that was my thing, was I love doing the medical call. I like the transport. I like knowing where it's going and what's going to happen. And so we need to continue having that across the board, and it's just, we're hitting that tipping point, I think, in a lot of ways where, a fire department really, it's the same thing that we see with police departments, where it's like, neither one should really have to do that. We should all be helping each other because we're all working in the emergency field. But, yeah.
So what's a bus shift?
It's just the colloquial term for the ambulance. Everybody would always call the rescue ambulance. Either you call it the rescue or call it the bus, because it was.
East Coast.
Is it East
Bus.
Coast? Okay.
Bus. Did you
It was
did you park
primarily
in the
a
barn and go
firefighter
back in
thing,
the barn,
too.
back in service.
Yeah, you gotta take a left at the oak tree before you get to the station.
Are the firefighters all required to be EMS?
Not always, but the majority of places are requiring the firefighters to at least be EMTs. But I've still seen, when you get out into rural areas like this, there's a lot of places that they may only require them to be a first responder.
Well,
as
my point
opposed
is,
to- or an
with
EMR.
their on and off schedule, most firefighters do something else. Would it behoove us to tap that and see if anybody would be willing to come over? and
Funny you
help?
mentioned
Cave
that.
town.
So we've got a couple, but we lost a few over the years because they don't
Oh,
want to do
okay. I was
transfers.
just- Yeah.
But we do have one recently that we just hired back, and then
Gotcha.
a couple more are probably interested.
Yeah, when you think about, it's just the difference in mentality to.
No,
Yeah,
Yeah.
and it just weighs heavy on a lot of firefighters when they have to do a long transport that has a lot of repetitive things that are all medical, and it's just not what they wanted to be there for in the first place. And they do it, but it's like, I can see how it stresses a lot of folks out, where it's like, this is not why I was here. This
Right.
isn't why I got into the stress and why I went to fire school or fire academy. And
Gotcha.
Do you have something, Tom?
Do we have any that are crossover that are working both?
Yeah.
We do.
Yeah. So we just brought one back that used to work for us, and I think he just cleared.
Mhm.
Yes. He
So
cleared
he
Monday.
just cleared. And then I heard that there was one or two that were interested in coming back.
Would that help with maybe the burnout situation?
Maybe a little bit. We've got.
We just put, when I get to my report.
We'll wait for Bubba's report then. It might help a little bit, but we've got, like I said, we've got probably 15 or 20 PRN employees, and they can do one shift every couple months, and we're having consistently 10 shifts open a month.
Is it a thing where it's like we could hire more EMTs and start doing more BLS with like ALS intercepts or something?
We could, but then we'd have too many employees once those people come off workers' comp. Then what do we do with them?
Yep, and then,
And
yeah,
nobody
somebody's
wants a
doing-
temporary full-time job anymore.
Yeah.
So, so it's kind of tough. For Colorado EMS headlines, October 10th was the SEMTAC meeting, the State Emergency Medical and Trauma Services Advisory Council. I'm trying to do better, Tom. And that was in Steamboat Springs, and they talked about EMS funding and sustainability, and that's where the Interfacility Task Force was brought up again, so we're gonna get those running again. October 16th, CDPHE, the Colorado Department of Public Health and Environment, published the Granite Ambulance Agencies must hold a state-issued license. So that rule, that was a 2024 bill that went through, and it was, parts of it were established in July of 25 all the way through July of 27. So we're slowly putting little pieces together. And then October 21st, Eagle County started their whole blood program.
Whoa.
So I think they're
Aren't they rural?
fourth or fifth. Yeah, they're pretty rural.
So what do they do? Do they have a trauma center somewhere close?
I don't know who they're using. The one that I know, Pueblo County, they just started theirs about a month ago, and they've already given five units, I believe, and they're able to just trade it out with Parkview.
Okay,
So-
that makes sense.
So my concern, so what they said at the state was they don't want the blood to go to waste. And so they were wanting it swapped with a level 2 or a level 1 trauma center. And Pueblo's a level 3. No,
Is that-
Parkview's a level 2 again.
But,
They
I mean,
just
you're
got their
talking-
level 2 designation back.
They did?
Yeah,
Parkview?
yeah.
Okay.
So they just got their level 2 designation back. But because they have to rotate, I think it's gonna be hard for us to be able to get in that rotation.
But it's only like 30, 40 extra minutes to get up to like St. Francis. Right?
Yeah.
So it's like,
But El Paso County's had their whole blood program going for almost a year now, and they've given 30 plus units in that time. So they're consistently giving blood. So I don't know. It's something that we still
That's-
need to look into.
but that's really exciting to know that somewhere like Eagle County that is more similar to us is actually doing it. So we have a thing that we can now study and see if there's like, are there shortfalls that they're coming up or they're hitting? Are there issues that they're going through, or is their system working out good and we just need to figure out how to set it up
Yeah.
here? As I imagine it, is it primarily just finding an organization, like contracting with a hospital to take the blood and then finding an organization to transport the blood when needed?
So they've got all that set up at the state level. It's just a matter of the waste. So trying to figure out how not to waste the blood.
Mhm.
So it would be rotating with a hospital.
Okay,
whether
and that's more of like a-
Parkview or somebody in Springs.
And and that would be like kind of keeping a semi-live inventory of like
Yeah.
whether they literally.
And I think
need
you have to
or
use
not.
it or rotate it every 10 to 14 days.
Okay.
The one we can even look at even better is Gunnison, because they have a rural critical access hospital and they're running blood. But they're also talking, and Chief's probably more up on this, is blood products, not just whole blood. So hopefully there might be some other options down the road.
Mhm.
Yeah.
That's cool. It's nice to see it taking a step forward. That's nice.
So there's no new legislation at the federal level, but we are still pushing our legislators to support the S-1643 and the HR 2232, which is the Medicare add-ons. And we're pushing for them to make that retroactive to October 1st, which, like I said, they've done in the past, so I'm not really concerned that that won't happen. It's just a matter of getting the government back open and getting that bill. And then there's no new documentaries or awareness, but I thought it was kind of cool. I went and pulled reviews of Code 3 that just came out, and I figured I'd throw some reviews up there. I'm not going to read through them. If you guys want to, I'll leave it up there if you want to read through them. But it was kind of cool because it sounds like a lot of EMS providers that have watched this said that this really brings a light to what EMS is, and it shows the burnout, and it shows the types of calls we run. So I thought it was kind of neat to throw that up there.
This might be the one. There's one that I was waiting on for, man, when I first started, I was in school, I had a preceptor show me, it was like a trailer, and it might be this one. And the fact that it says dark comedy, and I think it was Code 3.
It might be.
But yeah, there was one that it was like, just the trailer was like almost would bring tears to my eyes, because it's like, oh my God, that's us.
Yeah.
Like, oh, that's
Yeah.
what we did.
That's, a lot of the reviews say that it really kind of focuses on what EMS is.
Wow.
So, and that's all I have.
When we win the appeal for the court action, I really think that they'll start calming everything down. We probably should do a work session with the city and the county and show a film like that to them, because I think if the more you keep things in front of everybody, the more they remember and the more they empathize versus,
Yeah.
look at the negative all the time.
Yeah.
So, what we fight.
Yeah, I agree. And it's, I mean, understanding the human element, that it's like, we're all people that do this. We're all people that are willing to go through this.
Well, I've just had success with the emergency management and everybody kind of working together, and the spirit, that I like to keep that going, because it's
Yeah,
us, it's not you and me or him or
Right,
her.
absolutely.
It's us.
I think so. I
That
think
might
that's
actually
smart.
be a good thing to do during EMS week.
And when that,
Oh, man,
there might
that's
be little
smart.
hard feelings, but we need to mend those feelings, and we need
Yeah.
to show, that here's the purpose behind it.
Mhm.
Maybe we can partner with the Movie Picture Showhouse to show it there for EMS week.
We just
That would
say
be
the same
really
things.
cool.
And Barb and I'll buy everybody's love and buy them popcorn and goodies.
You guys are good at that.
Thanks, Dad.
I
Might
know,
be
I-
Christmas cash, I don't remember if they're participating.
I think the city will give us a coupon.
Yeah.
Back to that, will we at some point have an executive session for review of the brief, discussions? So Lynette and I are both new, and I haven't seen any of the legal documents at all. I think we need at least an opportunity to be able to ask questions. It
Yeah,
doesn't-
I think that's very smart. We got that. We had the exact same concern when we all first got on the board and were offered that opportunity. I think it's only right to offer you guys the same opportunity.
Same question we asked.
Yeah,
Yeah.
absolutely, because
Well,
it's a complicated situation, and it's had a lot of ebbs and flows, and so I totally respect that.
We can, so the problem was, there was a hard time getting stuff from the county certified, and then once we finally got that, it's been kind of kicked down the road a little bit because that attorney was dealing with other things, and that's it. And so, like I said, we're barely getting to review the opening brief, hopefully tonight, and then it's due Friday. So our next meeting, I can either see if he's available, and if he's not, I can have Catherine, who's gonna help him with it, have her present at the next board meeting if you guys wanna do that.
in executive session.
Yeah,
Yeah, I think that would be a great idea.
so we can do that.
Well, and I think.
Same
is what
trepidation
Joe-
I had.
Well, and what you suggested, I'm not sure exactly how that fits in. Maybe it does, maybe it doesn't. I just need to be caught up so I understand how that fits
Well,
in,
it-
that presentation of, that to city and county.
Yeah.
I remember what I remember of your presentation to the county, and so I'm just not understanding how they'll perceive it necessarily.
Well, first we have to see how it settles down, what the outcome is. Then once we have an outcome, that's the outcome. Now we can build on that versus, speculate. Before, a lot of those conversations were speculative. We didn't know or it wasn't settled yet. Now, with this brief being filed, it's going to get settled one way or the other.
Right.
And once we have that settlement, and this is the way it is now, let's just say we win that agreement, then the county has to accept it. There's no ifs, ands, or buts. So with that forcible acceptance, we want to make sure that they understand it
Okay.
and it's clear. That's just my 2 cents anyway.
No, I agree.
So, yeah, unless anybody has any questions.
Are we the contractor?
Yes.
I assume. Just wanted to make sure before I signed my life away.
Let me ask one question about, go back to the grants again. We decided to go solo on some and together on others. Is that gonna be just one specific grant, or is that gonna be?
I don't understand.
So that one grant, we were gonna go on our own and submit it.
With the hospital association.
Oh, so, no, so what that is we had to submit a proposal to Medicaid HICPUF.
Yeah,
And then HICPUF applies to the federal government on the state's behalf.
I got you.
And so if the state gets approved for that grant and they get the money, then it's up to every agency at that point to have to reapply and ask
Gotcha.
for what they want.
Gotcha.
So the only concern was the grant, part of the grant is, it's supposed to be for rural healthcare. So it's supposed to show hospitals and EMS providers and clinics and everybody partnering to show how to fix the rural healthcare system.
Right.
And with one agency or association saying, we're gonna go after all the money, we don't want your help, concerns me on a state level.
Gotcha.
So, but it was just a proposal to them so that the state can apply on
Okay,
everyone's
I
behalf.
understand. Because we had a problem with Homeland Security grants. Everybody was on their own pretty much, and we decided as the South Region, as the 5 counties, to go in as a group and pool all our grant requests. And so they thought it was a bit of strength in numbers versus,
Yeah, and there usually is.
you know, picking them one at a time, so.
We'll see what
Okay.
happens.
All right. I understand better.
So that puts us into the operations report. Bubba.
Okay, so I'm gonna first start off by apologizing that I made a mistake. With the trucks that we're trying to keep on the road, I told our vendor, the mechanic, to order a part. The part and the repair is gonna be over chief spending limit. We're required to get a new exhaust muffler filter, which is $7,000, and it's $1,000 to install it. So Chief let me know when I did that I outstepped his bounds as well. So I have to come to the board and say that I made that mistake. They have ordered it. It's something, we got to keep that ambulance on the road for a minimum of 2 more years. So I did that without thinking. So we'll have to rectify that, and I'll look for your forgiveness for one thing, and then also a way to do that, if we can do that under miscellaneous. At tonight's meeting, that would be great. If not, I'll ask M&M to hold off. It is ordered, it should be here within a week or 2 weeks. One of the things is it's very hard to come by. And like I said, I made a mistake and I get to own it, so that's where I'm at with that. So, onward and upward, we had 188 calls for service last month, which was down 57 calls from the previous month. We had one of the on-call crews do a call with the transport. We did have 2 units at the Rad Race standby, which garnered 1 transport out of that. And Chief and I both did 2 calls. We're on the same calls. Inter-facility transfers were up by 13, and we had 2 transports home. To my knowledge, for Zach, I didn't have a pretty graph for it, but we didn't delay any transports. Year to date so far, we've done 287 IFTs. Last month's mileage is the highest mileage for the year at 7,996.5. And year-to-date mileage is 54,742.5. That's for everybody that's 5'10" and a half. So once again, we have 5 of the 6 trucks in service right now. The one needing the exhaust filter and turbo parts. Crew corners. For our crew corner, we still are visiting the senior center. Farmers market, I believe, is done for now. We will be for Halloween. We'll spread the crews very thin. We go to the college. We've been invited to COG this year. We do downtown as well. I think that's the three. Chief just approved, I believe it was $1 billion for candy purchase. So I don't know how I'm getting in trouble
You don't
for
get a
8,000.
Yeah, I see what he did there.
See
It's
where
like
that
sleight
went?
of hand.
So the good news is we've had 2 EMTs and 1 paramedic cleared off of our FI program, which is a field internship program. So one of the EMTs has already started picking up shifts. The other one is going to start. I'm pretty optimistic that that's going to help out with some of the fatigue and stuff we have on our staff. And we have 1 other EMT that should be shortly clearing the FI program. So we still have the 2 employees out on workman's comp. Both of them have critical tests and surgeries on the 30th of this month. So we'll be thinking of them in our hopes and prayers. The other thing is talking about grants and collaborating. There was an opportunity that came up with a very short window to go for an OHI grant, O-E-H-I, and I do not know what that acronym is. But the opportunity was for innovation and helping rural healthcare get broaden out and expand. The 3, we went in conjunction with UPRAD or UPass Regional Health District, Eagle County Paramedics that just started blood, and Delta County Ambulance. All of them are have already MIH or Mobile Integrated Health Community Paramedic programs, and we have been graciously selected as their little orphan children, and we've been taking every opportunity to do that. So,
It stands for Office of E-Health Innovation.
Yeah.
Attaboy.
good job. So, OEHI. With this grant, I'll pass around, this is the list. The dollar figure at the end of it was $900,562. I was a little worried about doing this to start out with, and when I talked with our other 3 groups that we were talking with, they felt that we actually have a better chance at this grant. They all are asking for about the same dollar figure, upwards of above $850,000 to $1 million. It was a grant for up to $1 million. This is basically a grant to kickstart the Mobile Integrated Health and Community Paramedic program, which has built in there a number of different things. And I'll just kind of go through it. Of the $900,562, that includes 2 community paramedics. It also includes 30% of my wages to go out and meet with the regional partners like the hospitals and the discharge planners and Health Solutions and Rocky Mountain Health and all that kind of stuff to get that going. We would add 2 brand new Ford Expeditions to the fleet. Those will be fully equipped with lights and equipment, or emergency equipment, lab equipment, cardiac monitors. It'll have places for the secure transporter to hold the behavioral clients until we get the secure transport, so for their safety and our safety as well. Ultrasound machines, which we're looking at moving forward with the community paramedics, narc storage boxes, refrigerators for the medication. And then the other thing is we went in as the 4 districts as a consortium, and what that means is we're all asking in each grant $45,000, and what that covers is a healthcare economist and a healthcare analyst. So this is where the cool part kind of funnels back to us. Besides, if we're awarded this grant and we get the jump start on the program, in addition to that, Delta County, UPRAD, and Eagle County already has a vast amount of community paramedic data. So the goal is with this and being the innovation is to put that data together, go to our legislators to help get the treatment in place and help get the community paramedic programs and the MIH programs up and running and those type of things. In addition to that, we'll have a dashboard that we can pull that data off from each area. And by, I believe, with the consortium that we're looking at covers 16,000, which is 16,700 square miles of Colorado, which is about 23-24% of Colorado with just those 4 districts. So the other thing that was kind of cool with that, since we worked together and we were brainstorming on what we could do with the grant, one of the initiatives that Chief Moreno has been really excited about is the 4-minute community, and that's the AEDs with mapping and all the good stuff that'll alert dispatch if there's an incident. Also, you can have an app on your phone if you're a responder. So
If you're
in
CPR
this,
certified.
what's that?
If you're CPR certified.
If you're CPR certified, you can get the app.
So if you're CPR certified, you can get an app, and then dispatch can just alert if there's a cardiac arrest in that area. And if you're in that area, it'll show you where the AED is, and you go to the AED, and then you can start CPR before EMS or fire gets there.
Yeah, I want to say it was like about 10 years ago, Seattle was having a lot of luck with it. It was doing really, really well. You're talking like people being on scene doing compressions in 60 seconds, which is crazy.
Does this
So-
grant have a match?
No match.
No match.
No match.
And it was $1 million each, right?
It's $1 million each,
Wow.
up to $1 million each.
Wow.
And now it's a short grant. It's only 6 months. Actually, it's 23 weeks. So those wages for the 3 individuals will be just for that 6-month period, but that's what it's for, is to get that jump started. So we built in, we hired a grant writer to do the narrative part of it, which I didn't show you, but I have that if you'd like to see it. And that, it just turned out great. And with the collaboration between everybody, I hope we have a really good chance to do that. So with that, getting back to the AEDs, we put in for 80 of those AEDs, which itself was about $219,000. So, and then besides the vehicles, we'll get 2 new cardiac monitors, everything, the radios, all that stuff that goes with
So
it.
is it an all or nothing grant? Could you receive a partial award if there's?
I don't think so. I think it's going to be, because they set it at $1 million, I think that's what you're within that limit, my understanding. The other thing that the actual grant writer that worked with us, that I hope to be working with in the future as well, used to work for HICPUF, used to work for the behavioral health side of things, knows how these grants and those things go together. So it was a great opportunity to utilize her and move forward. So that's our good news to end on that.
Is that a 100% grant?
It is. It is.
Sorry, Tom, I forgot. HICPUF is Healthcare Policy and Finance.
Thank you.
That one's tricky. It does just kind of sound like a word.
Yeah.
Any questions?
Just a couple things. The overspent, there's nothing on the agenda, and so legally we can't act on it tonight.
Okay.
We don't have a miscellaneous item. If it had been included, absolutely we could have, but we can't. So, I've been trying to think, I missed half your presentation because I've been trying to think of how to keep the project going, and so just give me a minute on that, to think that through.
Yeah.
Well, if it's gonna be a couple weeks, if we were gonna move the November meeting forward because of Thanksgiving,
Oh, there you go.
That's a
then,
great idea.
then we can just put it on the next meeting and do it like the
During
12th
the
or the
month.
19th, and it'll probably be fine.
Okay.
Let's do that.
Yeah.
As long as it's semi-approved and we can keep the park coming, then I think we're fine to just do that.
Okay.
I just wanted to be upfront and make sure that you guys are aware that happened.
Yeah, I
No, I
appreciate that.
appreciate that too, yeah.
So,
Plus
But
you made a mistake.
I will say, it's something that is intricate because that ambulance is actually down it's not operable with it the way it is, so.
There should be some penalty push-ups or something.
I like that
Yes.
idea.
Yeah,
I knew I liked you.
Yeah, there's-
Well, I don't know, I think we're going to the movies and he's buying.
Can we just get by with the
Extra
movie?
butter.
Extra butter. Liquor there,
Yeah,
yeah.
light salt.
Yeah, they do.
So an open tab.
yeah. Ooh, now
So
we're
is-
So I
talking.
guess the only other thing I would say is maybe for future agendas, if you're aware in enough time, even if you amend that agenda to get it added, it would probably be helpful so that you're not stressing over timing of getting the work done.
Yeah, I agree
We
with
played
that.
hooky Monday and Tuesday, otherwise we could have fixed it.
Now he's on blast. Can you hear us under that bus?
I got you. And you know what? I'm a big enough person to,
No,
You
I made
mess
a
up, you
mistake
gotta own
once,
it.
and I know how it feels, so God knows.
I'll schedule a chiropractor appointment for later, early next week. So that's what I have for you.
Any questions, comments, concerns?
Hey, good report.
Yep. I'm very excited for this grant. This is a really cool opportunity.
Zach, I did put the end at the bottom of the page.
And
Yeah, I want to see EOM at the end, or else how am I supposed to know it's done? That will put us on to item number 7, unfinished business, and 7A is public perception campaign. Again, just revisiting this, I think we've actually kind of touched on this a bit already in this meeting in tangential ways, like doing EMS week, trying to show a movie as like a work session or something, and get it involved with the community and see what we can do. I think that is a beautiful idea to really, like I said, it just was always surprising to me how many even nurses really had no idea the life on an ambulance or what goes into being in people's homes and being a part of these outcomes all the time. And I think it's a really good idea to help people understand and show it's like, hey, look guys, we go through this because we care. This is a lot of stuff to go through. It's a lot of stress, but it's something that, as for one reason or another, as people, we're willing to do. And I think it's very nice to let people in. I think part of it is breaking down that wall. If, we're all trying to be strong and big problem solvers, but it's like eventually you got to break down the wall and let people see that it's like, no, we are people. We go through burnout, we go through depression, we go through all sorts of stuff because we do get attached to some patients and we do really want to see an outcome that's never going to happen sometimes. And so I think that is something that gets lost in translation a lot, and something like these movies, it's finally starting to be a point of interest for people. And so being able to really show them, I mean, it was just a few years ago now that it was kind of fire departments went through a lot of this, where television shows and documentaries and all sorts of stuff were really focusing on fire departments. And I think it's a good opportunity for us to connect with the community more and show a little bit of why we do this and why we're still a part of everything after a lot of the stress and trauma and troubles and financial issues that never seem to end. But it's like, I think we all seem to have a calling towards it, and it's good to share it because it's a calling that it tends to be inherently selfless. It's a calling that is most often, I want to be here because it's a situation that's terrifying, or I know I can be here for you in a way that I'm not sure other people could. And so I think we've already done a really good job of touching on some public perception ideas this meeting, because I think that has got the wheels turning for me a lot. Anybody else have any?
I haven't had anything positive or negative. So I think things were just calm.
Yeah. Yep.
I had a conversation today with someone that had high praises for the ambulance service in a call that he was at, and so of course I did my part and said, okay, here's the deal. Here's what you have to know about the narrative out there and how it's wrong, and please, if you hear this incorrect narrative, correct it.
Thank you.
Awesome. Thank you very much.
Thank you.
Yeah. I mean, I can't thank you guys enough, because you really do make this part easy, where it's like we can go to bat for you, because you guys are consistently out there doing the right thing and going above and beyond doing it, and that's huge. I appreciate it.
Makes the difference.
Please relay our
We will.
gratitude.
Absolutely. We appreciate you guys. Thank you.
Yeah, absolutely.
If they could kill the siren when they go by my house.
I'm gonna
Every
start
day.
air horning.
Yeah, I was about to
That
say,
was a
I'm a
mistake.
big fan of sirens, I
I know
really
what the
like
air
them.
horn button is.
Yeah.
I'll go around the block.
Do you have that cool hidden
No
fourth
extra
beat, that
cheese.
fourth one that's after the priority, that's like the weird Euro tone?
Oh, I'm in 2001, I've got a rumor.
Yeah, come on.
Sometimes
It works for me 95%
Does it
of
really?
the
Must be
time.
nice. Yeah, I get it.
As
Maybe
long as
50.
no one don't touch it, I'm good.
It would just be showing off if it rumbled all the
You're
time.
right.
Any other comments, questions, concerns on public perception?
No.
Then that would move us on to item number 8, public comments.
No one registered for public comments?
Gotcha. And item number 9 then, new business. 9A is gonna be legal counsel.
So, did you put that in the board packet? So,
Yes.
I failed to get more than one quote, because I ended up getting busy, so I got the one quote from Catherine,
Mm-hmm.
from Cole Flynn.
No.
But I am gonna reach out to the Special District Association and see if we can get a couple more.
Okay,
So we can just put that on hold for the next meeting.
okay,
That was my fault.
that's okay. I think it's an important enough topic that it's good to just touch on it real quick. and
Yeah.
That's
Yeah.
fine.
The one proposal is in here, in the
Mhm.
Okay.
packet.
Mhm.
Cool. Any questions on 9A?
So motion to table consideration until we see additional quotes.
You just want 2 more? At least 2 more?
Couple would be nice.
Yeah.
Sometimes it's hard to get, and it's hard. It's an area where probably it's professional service, and you're going to get like amounts. It's going to probably boil down to what's the best fit for the district. So if you can find additional quotes, yes, but really you want more than quotes. You want you want qualifications. You want to know what service they provide or what other entities they represent, so that we're considering somebody who has knowledge about special districts and ambulance in
Yep.
particular.
And the Special District Association will recommend some places, but I'm also gonna reach out to other health service districts and ambulance districts to see who they're using.
Yeah.
Because obviously their experience, I'd rather have somebody with that
Right.
experience.
For sure.
I mean, it's very similar to the accounting firm.
Yeah.
They may be more expensive, but if they have the familiarity, it's a professional services. Yes, you want to make sure that you're not overspending, but at the same time, that's a consideration.
Absolutely,
So
absolutely.
So that would be a motion on the floor.
a motion to table until we can see
Yeah.
get additional information.
I'll entertain a second.
Second.
Cool.
Zach,
Yes.
Joe,
Yes,
Tom,
Yes.
Lynette,
Yes.
Audra.
Yes.
That will move us on to item 9B, dispatch service proposals.
So this, I would also suggest or request that we table it probably till we get an outcome of the appeal stuff. We've got 2 quotes. One of them I want to get rid of because he reached out to the state and pissed off the state, and she emailed me, and that is not a good thing.
Mhm. Already?
So,
It's like we're
yeah.
not even contracted with
Yeah,
the,
so and that was Echo 911, and so we sent their equipment back. And,
Was that the new one?
Yeah,
That was the one that, yeah, it was
Yeah.
like a little concerning because it's like, what if they disappear where AMR is everywhere?
so the only quote we have now is AMR, and they were still kind of pricey. So really what we want to look for is somebody who can help us with our MIH stuff anyway.
Mhm.
I still have a request out to State Patrol, because they're doing EMS in the San Luis Valley, and then to South Metro.
Like they run the actual ambulances or they're just doing
No, they're doing
dispatch?
dispatching
Okay.
for the
I was like,
ambulances.
that's crazy.
And they're doing
Fair enough.
and they're doing EMD.
Okay,
in
Wow.
the San Luis Valley.
That's cool.
So I've still got requests out to them to see what they come back with.
Yeah.
But I would like to table that until probably after the first of the year.
Cool. I'd entertain a motion to table.
I'll make a motion, we table the dispatch service proposal till next
Question
meeting.
after.
Okay, cool.
I'll second.
So just out of curiosity, our former council member Anthony Matei spoke at length at times about being highway patrolmen. How are they trained in EMS? Because sometimes they're, of course, the first ones there.
I truly don't know, to be honest with you, because I was kind of surprised when somebody suggested state patrol, and then we reached out and did a little bit more research and found out that they're actually doing the EMD and the EMS for the San Luis Valley. So I don't know until they get back to me how long they've been doing it or really any kind of information.
But my guess is they just specialized in it. They just put their dispatchers through the EMD course so that they were certified in EMD, because their police dispatching is pretty rigorous.
But I mean,
You're
highway
thinking of the
patrolmen,
actual troopers.
They show up, they're first ones there.
Yeah.
What is it?
Oh, they're usually,
Troopers.
if they're certified in anything, they're typically like EMRs, emergency medical responders, like the new version of the first responder. So it's like they're like first aid, stuff like that, first aid, bleeding control.
So
They're so
CPR.
short-handed in our two counties that it's 30 to 45 minutes at best to get them there now, so
Yeah.
unfortunately.
What, I just know Anthony said he was first on
Right.
many horrific
Yeah.
scenes. And you imagine that they're gonna be called in to do what they can.
Mhm.
I'm just curious what sort of, I never asked him that.
So I know they're required to have first aid CPR at a minimum.
Yeah.
If
Yeah.
they have anything higher than that, that's on them personally if they want to do it.
I don't
Or
know
a
that I've
previous
seen many
background.
cops that were cross-trained as paramedics. Like some I've
Had a
seen as
couple Pueblo.
EMTs, but
I had a few in Pueblo.
yeah,
Yeah.
nice.
I actually had one that was a part-time EMT with the ambulance and he was a full-time cop.
Oh, okay, nice. It's just, it's less common, usually, like, it's less common than you see in the fire department, per se. Police, I more often have seen, like
Actually,
EMS.
we have a city cop that's going to the EMT course right now.
That's what I was gonna
Whoa.
say, I just had an EMT student ride with me the other day, that is one of our Trinidad PD.
Wow,
And he wants to apply part-time, so
I'm proud.
yeah.
That's cool.
So we have a motion on the floor to table dispatch services discussions until after, did you want that, is that until after January 1st, or is it?
Yeah.
Okay,
So we'll table until the January meeting.
yeah. And that motion was made by Joe Richards, seconded by Lynette Bates, so we need to vote on that. Zach,
Yes.
Joe,
Yes.
Tom,
Yes.
Lynette,
Yes.
Audra,
Yes.
thank you.
That just leaves us with needing a motion to adjourn.
So I would suggest to pick a meeting date for November.
Oh, yeah, good idea.
Mhm.
And my suggestion would be the 12th or the 19th.
So we're gonna do it at, you're thinking, so last year, didn't we do it at the beginning of December?
Mhm.
Yeah.
Is that what you're saying, is
No.
the 12th or the 19th of December?
No.
November.
No, we
The
really
12th or
need to
19th
do,
of
we need to do that,
So
we
we
have,
can
we
get
have
the
some
vehicle-
issues we have to address
I got you.
before Thanksgiving. So-
Okay.
If any way possible, in light of my mishap, if we could do it, the 12th would be better.
Okay.
I would agree.
That's just another
Yeah, I'm
week.
okay with that. So we'll do Wednesday, November 12th at 4:30.
I'm telling you right now, we might not have financials for that meeting
Yeah.
unless we can get this new proposal signed, so
Yeah,
just,
just beware.
Okay.
Before we adjourn, I would like to say thank you for Stop the Bleed Kids.
oh, you're welcome. I forgot. We donated 7 Stop the Bleed kits to the college.
We'll try to get
That's
those
awesome.
distributed to the different buildings, departments next week.
Thank you for the reminder.
Thank you.
That's awesome.
As soon as we get that grant, hopefully you'll see some alive new AEDs.
Ooh.
Wait, wait, wait.
So I will.
That's up to
Move to adjourn.
Yep.
Go, Hollinger.
Second.
Joe? Zach?
Yes.
Joe?
Yes.
Tom?
Yes.
Jeanette?
Yes.
Audra?
Yes.
Bang.
1742.